So I think we can go on. My topic today is micromovements on implant abutment interfaces, causes and consequences. And this brings us to the first question, why we should have a closer look to the mechanics of implant abutment interfaces. If you ask the implant companies, they always will tell, we've got no problems with the mechanic. We have no screw loosening, perhaps parts per million or something like this. But then is the question why we find in the literature and in some studies these results. We find fractured implant components. We find broken binding screws, loosened binding screws, and perhaps some damaged implants. And we also see that there is a bone loss surrounding the most implants, especially down to the first thread. And the consequences of this could be that we have a problem with our soft tissue. And one cause for this problem with the soft tissue could be the microgap. But the question is, what is the reason for this microgap and why we have some implant systems which has not these problems? So it is not the truth that every two-piece implant lose crustal bone in the first year after prosthetic restoration. We can also see over here, and this is a really interesting picture because only the platform switching is not able to prevent the bone loss. What is the cause for these micro-movements and microgaps? These are the chewing forces, and some measurement of chewing forces shows us that we have a large and high average of approximately 210 newtons. If we chew bread, it's about 100 newtons, and if you chew chili babies, it's more than 250 newtons. It's really interesting. So the chili babies could, in the future, be the killer of our dental implants. There is some elastic deformation and some microgaps. And the question is the screw really the clue? So if we found a better binding screw, we solved the problem. The best way to show this or to explain this problem is if we have a look at the Dipl Ing implant system, an original 4mm implant in comparison to a 5mm implant. And if we compare this both with a platform switched situation, so we have a 5mm implant diameter with a 4mm abutment. And if the screw will really be the clue, the microgap of the 4mm implant should be the same than the platform switched solution because we have the same binding screw with the same initial tension. Now we have a closer look at it, and in the overview we can see that there is a microgap inside of the 5mm implant, and if we have a closer look at it, we can clearly see that there is a microgap and also there's a microgap before, so the manufacturing tolerances in this system are not really perfect. If we compare this with a 4mm implant, it's clearly to see that the microgap increase, and also at the enlargement we can see that there is a really large microgap. But if we compare this with a platform switched solution, we will see that in the overview it's really hard to find the microgap. But if we go to the enlargement, we can see that there is a microgap, but it is really the microgap is really very small. So what is the reason for this? The reason for this are elastic deformation of the implant components, not only inside of the binding screw. So we have a look at the videos again, and please don't have a look to the region where the microgap will occur. Please have a look to the implant wall at the left side. And you will see that there is a really elastic deformation of the implant wall, and this is the reason for the large microgap. In comparison to this, the platform switched situation, and don't have a look to the microgap, please have a look to the implant wall on the right side, and you will see that there is no or only a small elastic deformation. So we can say the screw is only one part of the clue. We should have a look to the whole system. If we have a perfect binding screw and a bad implant, we solved nothing. So we have the chewing forces, and one result are the elastic deformation and the micro movements. But the elastic deformation occurs some shear forces between the implant and the bone, and this we could prove with this Camlock implant system, and we simulate a bone loss of 3 millimeters, and if we load it, you can see the elastic deformation of the implant wall. It's large, and if we simulate no bone loss, it's clearly to see that the elastic deformation decreases. Again, for better understanding, a large elastic deformation and a small elastic deformation. So, if we think about this, the bone, the surrounding bone, should stabilize the titanium implant. So it's logical that the crestal bone gets really high stress peaks when we load it. So this could also be a reason for the bone loss. But what is a consequence of these micro movements? One consequence is a microgap, and in my opinion, a micro pump effect. So if we have a look at this example, we can see really a large microgap, and if we have a look at the slow motion, you can see that we simulate the side teeth region at the 40-fold slow motion at 200 Newton. We will see that an actual force vectors is formed, so the connection moves a little bit down, and when the force vector tilts to the left side, or turns to the left side, the complete interface moves sideways, and the micro gap we will see is in an area of 36 microns. And now think about when this occurs once a day, week by week, day by day, and month by month. What will be the result? The result will be that the inner of the interface will be filled with fluids and bacteria. To prove this, we designed a special gingiva made from a silicon, and we have a special channel for a radio opaque material. And if we have a closer look at it and we start to load it, you can clearly see that the whole fluid will be sucked inside. It's not so good to see with its radio opaque material, so we used a better material, and now it's really easy to see that everything will be sucked inside. And now, ladies and gentlemen, please remember the good old days when you were a little child. Remember those rainy days when you and your friends nothing found thrilling than put on your rubber boots, going outside and jumping from puddle to puddle, until one of these puddles was too deep and all the muddy water comes inside of your rubber boots, and the way home was one squishy step after the other. And it looks a little bit similar what we see here. But you have an advantage. When you were at home, you put off your rubber boots and dry your feet and everything was okay. But your patients cannot remove the abutment every day to dry and clean it. So the result looks perhaps like this. We have really terrible substances at these abutments with a terrible smell. And try it. If you use flat-to-flat interfaces, remove the abutments after 1 year or 2 years and smell the smell. It's really terrible. This will not occur if you use conical interfaces based on the fact that we have no microgap inside. So if we load it, the Astrotech system, it looks like a virtual one-piece.